Waste management. Objective: to learn the effective segregation of waste and the separate handling and disposal of each segregated waste category. Proper disposal of medical waste is important for healthcare workers, patients, and to keep our environment clean. It is crucial to segregate medical waste effectively. Classification of waste: general waste, pathological waste, radioactive waste, chemical waste, infectious or potentially infectious waste, and sharps pharmaceuticals. How to properly manage medical waste disposal. Importance of color coding. Color coding your biomedical waste containers has the following benefits: reduces the risk of injury to healthcare staff, makes segregation of medical waste easier, ensures waste streams are treated properly. Yellow. Used to store clinical waste that is infectious or potentially infectious. Reminder: ensure medical waste is placed in a strong bag before being put into the yellow bin to prevent spills and handle it safely to minimize the risk of spreading infection. Includes dressing, swabs, gloves, lab waste, PPE like aprons, masks and respirators, human or animal tissue, organs or body parts, blood bags, plaster casts, and contaminated hospital gowns. Red. Used to collect biohazardous waste, such as materials or instruments that have been contaminated with blood or bodily fluids. Includes anatomical waste such as organs, tissues, semen and saliva, animal carcasses, medical apparatus such as gloves, blood-soaked drips and specimen swabs, sharp materials such as needles, syringe, scalpel blades, test tubes, ampules, and broken glass. After the procedure, clean your area by disposing of sharp medical waste such as used needles. Dispose of needles in the red bin and the rest in the yellow bin. Remove your gloves and double bag them. Before removing your face mask, make sure your hands are sanitized. Dispose of used masks in the yellow trash bin. Proceed to the documentation. Block. Typically used for non-hazardous waste that doesn't pose a risk of infection or harm to humans. Includes paper towels, food wrappers, other non-recyclable materials that are not contaminated with bodily fluids or chemicals. Green. Used for non-infectious wet waste such as biodegradable materials. Includes leftover foods, used cooking oil, fruits and vegetable peelings, rotten fruits and vegetables. Blue. Used for contaminated glass waste that is to be recycled and sterilized. Includes glass equipments like ampules, pipettes, laboratory slides. Orange. Used to store radioactive waste or medical equipment that has been used contaminated or exposed to radioactivity. White. Used for general waste. However, in some cases, it may be used for sharps, which are items that can cause cuts or punctures, such as used needles, scalpels, or blades. If a white bin is used for sharps, it must be lined with puncture-proof bags and sent to a sanitary landfill. Reminder: all bags leaving a medical area should be sealed and labeled. The label should show a minimum, the name of the responsible medical person from the medical area, usually the head or the charge nurse, the date, and the department name.